So skills for backboarding a supine patient. So I'm going to walk in and I'm going to go BSI, scene is safe. You hold manual inline stabilization and don't let go. I'm going to come over, I'm going to check CMS in all four. I'm going to check for pulses. Can you squeeze? Can you feel? Come down and check the pedal pulses. Got pulses, can you pull? Can you push? Can you feel? Yeah. Okay? So now I need to apply a C-collar. I'm going to come and measure the patient. I measure her as a 2-finger. It is already set. I'm going to check for step-offs, tracheal deviation, and jugular distension. I'm going to slide the C-collar underneath the patient's head without moving it or excessively moving. I'm going to slide it underneath the chin, act like I'm choking her, and then apply the C-collar. Okay? It's a little bit small, so I might add some tape to make sure that it has secured the C-collar. Okay? At this point, I'm going to log roll the patient, so I need my proctor to come assist me in log rolling the patient. I would have the proctor put their hands on the hips and the lower leg. I'll put my hands on the shoulder and the thighs. And on your count of 3, we need to log roll the patient.
1, 2, 3.
Log roll. I'm going to feel the back, checking for step-offs all the way down to the buttocks. I'm going to auscultate the lungs on both sides. Bring the backboard over and get it in place at a 45-degree angle, and on your count, let's put it back.
1, 2, 3.
And roll. Okay. Looking at the head, it looks like we need to move the patient to the left and right about the same height. Is that right?
Yes.
Okay. So grab the hips, proctor. I'll grab the shoulders. Will somebody hold the board so it doesn't slide? Okay. On your count of 3, we're going to move down and over to the left and back up in one motion.
Okay, 1, 2, 3.
Down and back up, right about there. Okay, is she centered on the board?
Yes.
Okay, good. Now I'm going to apply the spider straps. Okay, somebody left in that jumbled mess for me. That was pretty nice.
Sorry.
You could have looked over your equipment.
Oh, yeah.
Okay, so I'm going to place them by putting the blue shoulder straps up here. I'm going to place all my straps in the places that they need to go. So I have the shoulder straps, the chest straps, the thigh straps, and the foot straps. Okay, I'm going to put the V of the shoulder straps right in the center of the chest, and I'm going to apply them as close to underneath the shoulders as I can get. Go ahead and do the other one. Okay, and I want to make sure that the V does not incorporate the C-collar. Then I'm going to come down and I'm going to do the feet. Okay, and I'm going to go ahead and pull this tight, make sure that my center strap is nice and centered, and that V at the chest doesn't go into the C-collar, so everything's good. So now I can place my spider straps. The second set goes on the femurs, okay, anywhere that's not over the femur fracture. Okay, I'm going to place the hip straps directly over the top of the superior iliac spines. The chest strap needs to go directly underneath the pecs or the breasts. Okay. At this time, I'm going to evaluate for padding between the ribs and the straps, the hips and the thighs, and she does not look like she needs any padding, so I'm going to get rid of that step. Come back over, and now I'm going to fully secure the torso to the backboard by tightening everything down. Go to the quads. Pull, go to the hips. Okay, and then make sure this is in there. Redo the shoulders. Okay, now I'm going to place the headbed. Okay, and I'm going to put the non-Velcro part against the head, and I'm going to make it nice and tight so that the head can't go either direction. I'm going to put the forehead strap from the top down. Then I'm going to take the chin strap and go underneath the chin, across all of the Velcro, and tape it down to the backboard. Okay, I've got the head fully secured. Now, I'm going to check CMS one last time in the arms. I'm going to check pulses. Can you squeeze? Can you feel? I need to secure the hands, so please hold the center strap for me. Come down, check pulses. Can you pull? Can you push? And can you feel? Task complete.